So here's my client, Michael. We last treated you on Monday, and that's Lola in the background. She's an 18-month-old puppy, and she would destroy the environment if we let her down. She'd be so hyper. So I just thought it might be nice to check in on Michael, since it's been 5 days since we treated the right ilium downslip. And of course, we treated a couple of other areas in your body. We treated your AC joint. But I just want to focus on the downslip treatment. So if you'd give us some feedback.
Yes. So basically, as noted in the last video, it was almost an instant relief / release on this right side. Since then, I have continued regular workouts in the gym. Nothing, no pain, no back pain. As we talked about, there's still a little bit of the endurance weakness, I think is what we refer to it as. So still a little bit of that, but no pain. Everything seems to be firing the way it's supposed to. So yeah, I think just a little bit of time and it will loosen up and be just like new. That's my
So what are you going to do this weekend?
This weekend I'm planning to go ski and really test this thing out.
That'll test it.
Yep.
That's
So,
for sure. But at 5 days, given that you've been working out and such, and I just tested it a while ago and it was testing very well. The sacrotuberous ligament was normal tone. It wasn't really tight as it was on Monday. And you had good superior glide mobility through the right half of the pelvis, through the sit bone.
Yes.
So I feel like the downslip is very much under control.
I do as well. Like I said, in my drive over here, there's a lot of discomfort sitting, especially in one position the whole time, moving legs around, trying to find that comfortable spot. Had none of that, just cruised over and honestly didn't really think about it until we were discussing how I felt. And for me, that's a big thing, to be able to go that long in the car or sitting in one place without having to squirm around. So
super. So in conclusion, I would say downslip is a valid type of back pain, sacroiliac joint dysfunction. Lots of controversy because we can't look inside the joint in the clinic.
Yeah.
So there's a lot of naysayers. And there's a lot of people who say that downslip doesn't exist because when people walk, it just moves it back up. And that's really not true, because walking doesn't capture the appropriate angle. It doesn't simulate that angle that I use to move it back up. And I tested you first because there's individual variation. And we found that when you were supine and we adducted your hip about 20 degrees, that was that sweet spot, so where I could induce vertical force through and see the pelvis move. Yes. And so I just leaned on that for 5 minutes. But again, I'm trying to document my cases of downslip to build up a little library of case studies. So I certainly appreciate you letting me do this.
Not a problem. I certainly appreciate your help, because there might be naysayers, but for 3 years I've been told it's tightness in the piriformis, everything else, and none of that, loosening that up, has been effective. Whereas in 2 visits, this has been life-changing. So
very good. And you'll know to come back as needed.
Yes.
But otherwise, I feel like we've done our job.
I love it.
Great. Thanks so much.
Thank you.